All right, so yeah, another first for us at Clute Wealth Management. Adam and I are coming to you guys today to have our first Lakeside After Chat. What happened last week was that we had Valerie Mariani from Fidelity with us to discuss Medicare, and unfortunately, we weren't able to record that. So we thought it'd be a great idea to talk about some of the highlights that we discussed during last week's call, as well as bring you some information from the Medicare.gov booklet. And so here we are today. Feel free to give us a call if you have any questions. We are not experts in this by any means, but always happy to help in this very confusing topic.
Awesome. Thanks, Christina. I believe that I'm going to share my screen real quick and we'll kind of show some graphics to go along with everything. So we should be good to go with that right now.
Perfect. Yes, I can see it.
All right.
Okay, great. So the first thing that Valerie shared with us is what the estimated out-of-pocket cost is for a 65-year-old couple retiring. And Fidelity did this study themselves, and they estimated that it's about $300,000 out of pocket, which included, as you can see here, Medicare Part B and Part D premiums, which are your doctor's appointments and hospital visits, your drugs, both generic and branded, as well as specialty, and then all the other stuff that you're paying for, co-payments, co-insurance, deductibles for doctors and hospital visits. And they said that it works out to be about $7,000 a person per year during retirement. So just a really large number that we have to plan for.
Yeah, so that and that 7,000 if you're a couple, so that's 7,000 per person. Yes. With a couple. So that's definitely a huge chunk in someone's retirement that you might not think of.
Absolutely.
We also have here that there are two different ways to get Medicare. We're looking here at the Medicare booklet that they offer. It's got 128 pages, so there's a lot of stuff in here. So we're just kind of hitting the highlights here. But if we're looking at Medicare, there's original Medicare with Part A, hospital insurance, and Part B, medical. And that's any doctor or hospital. Any of them take Medicare. So you don't really have to worry about location. Then you have Medicare Advantage, which is Part C, and that is kind of Part A and Part B both rolled in there and bundled. And a lot of plans include Part D, which is prescription drug coverage, and some extra benefits thrown in there as well. So I kind of scroll down a bit just so you can see a little bit more there. So there's a lot to this. Really, our whole emphasis is going to be that you should really see for yourself what works best for you. There's a lot of little subtle differences between the two, between out-of-pocket cost differences and what things are covered, what co-insurance you might have to pay. So really, there's a lot to go in through in comparing the two different sides of possibilities.
Yeah, lots of information there. One of the most common questions that I know we get, and I'm sure that both Medicare and Medicare specialists get, are if there are penalties if somebody doesn't enroll when first eligible. So if we go to page 8, Adam, of that Medicare document, I believe it is. Yes. So this is a great page to look at for the important dates that we have to keep in mind, because there can be penalties if you are eligible to start and you haven't started. And one of the new things that we learned during the call or during the chat was that you have to have at least 20 employees in your business in order to not have to apply for Medicare right away. So lots of confusing rules and dates with this, but just try to keep October in mind for the most part, and then try to enroll in Medicare when eligible so that you don't have to worry about having to pay penalties down the road.
Yeah, October 15th through December 7th is if you have a Medicare with a Medigap or a Medicare Advantage plan, you can make all kinds of changes. January to March 31st is Medicare Advantage plan only changes. So really there's, again, subtleties there. So really,
And that one is only if your plan, I believe, is not renewing. So they give you an extra chance to go back and change it if you didn't do it during the open enrollment from October 1st to, or October 15th through December 7th.
Okay. Yeah. So really the biggest thing to be concerned about is making sure in October you're ready to take a look and see if you need to switch anything. And one of those big things to consider is if you have prescription drug coverage, whether it's Part D, whether it's part of a Medicare Advantage plan. The big thing that's changed in relation to Part D is that there used to be what they call the donut hole. And I'll show you that real quick. And basically that's kind of a weird limbo zone if you get put into there in terms of how much you're paying for your prescription drugs and how much was costing you out of pocket. And it was really just a really confusing thing. Not that the new system is very easy either, honestly, but what it really means is that there is more cost sharing, and that you're not necessarily paying as much as you could have before. So it's just something else to consider, and something that you're going to want to check with someone who really knows this stuff and knows can look up your medications specifically.
But like Adam said, the donut hole is closed as of what, 2020 was it?
2020 is closed, yes.
So that at least is good news to everyone.
Yeah.
Let's see here. So we're moving on to page 21.
Yes.
Of that. And this is a question that actually just came up today with my mother, which is really interesting, but wondering how her current insurance works with Medicare. And I think that this page is great because it has a couple of different scenes or scenarios, I should say, that you can apply yourself to. And then so if you're still working and you have group coverage and you have your employer has 20 or more employees, then the group plan would cover first. And then your Medicare would be your secondary insurance. Or if you're under 65 and have a disability, and then which one would cover first? If you have Medicaid. So it goes through a couple of different scenarios and answers those questions about if you have two kinds of insurance, which one would pay first, and who do you go through for that, which is a confusing topic.
Yeah, this I would say I had no idea that there was this much that just went into this one little part of Medicare, trying to figure that out. The other thing that I didn't realize is that you can't have Medicare work with marketplace insurance. And I just read that in this booklet earlier today, actually, that Medicare advises you to drop that coverage and sign up for Medicare when you're eligible. So that's just another one of the things that you might keep your group insurance, and that might show up as your secondary or your primary, but nothing with the health marketplace insurance.
And Adam, I think that you also mentioned that no health savings account contributions can be made once on Medicare as well.
Yeah, that's right, because HSAs or health savings accounts, you can't contribute to them if you're not in a high deductible plan. So once you fall under Medicare's umbrella, you're not considered to be in that high deductible plan anymore. So again, all kinds of little nuances.
Rules.
Yeah. So if we are moving on here, page 24 is where I'd like to visit next. Medicare premiums, if you aren't drawing Social Security yet, like we talked about, age 65 being the time that you are eligible for Medicare, some people don't draw Social Security at the same time. Sometimes they hold off a little bit longer. There's a couple different ways that you can actually pay for your Medicare coverage. Part A, you have to sign up, but it's still free. But Part B, you have to pay premiums. A lot of people have those deducted right from their Social Security. But if you're not in that Social Security system yet, you can either pay online, you can pay through a bill pay service. You have to have Medicare's information for that. You can sign up for an easy pay for what they call that, and good old fashioned mail. So.
And I think that it used to work out easier when the Social Security full retirement age was 65 or 62. So it almost coincided together. But now with most people, the full retirement age is at least 66.
Yeah.
So you have that first year of trying to figure out, unless you pulled out early,
Sure.
trying to figure out how to coordinate payments.
Yeah. Well, and I was thinking about it, but it's kind of like all the new streaming services. You used to maybe have a cable bundle or something, and now you have a lot of different a la carte options.
Yeah.
It's kind of the same way with Medicare and all the different things that you can have, because you can have, your Part B that you pay, you can have your Medigap payment that you have to do, maybe a Part D. So, you have all these different things that they may not just fall under one payment. So that's something that you want to be aware of.
All right. Oh, the next topic is one that confuses so many people, and we hear it asked constantly. Page 55 and page 28 of the Medicare booklet address the big question of, is long-term care coverage or benefits covered by Medicare? And so the easy answer is no. We should not be basing needing long-term care and using Medicare. We have to have something else that covers that outside of that. However, what confuses us the most, or makes us wonder if it really does cover it, is because there's very specific language and rules, once again, rules that state that if you are in the hospital a certain amount of time and you go straight to a nursing facility, then you may be covered if you're only there for a certain number of days, but after that, you would be responsible for it. So there's a lot of if this, if that, then this. So the easy answer is no, long-term care is not covered by Medicare, unlike most people believing that. And so if you need long-term care coverage, then you should look for it outside of Medicare and not be dependent on this. But check out those two pages, both 55 and 28, because they do go into it pretty well.
There's a lot of people, that's a good point. A lot of people see that, skilled nursing facility, they see that and they say, oh man, that must be long-term care, that it is covered. And there's lots of little tiny details that Medicare has that, there's days, you may have 20 days where you can be in a skilled nursing facility, but only after a 3-day inpatient hospital stay. And then after day 20, you have a co-insurance amount. There's all kinds of stuff there. Really, the main point would be, really have someone look into this for you if you feel like you need services like that. And, definitely different types of insurance for different needs.
Well, the most interesting thing about that is that it's that 3-day hospital stay, but most hospitals now have you in and out. It is getting rarer and rarer to have to be in a hospital for 3 days.
Well, in Medicare, their booklet actually tells you to ask someone in the hospital, if you're staying overnight, to ask them if it's inpatient or outpatient, even though you're actually there overnight. And you should do that every day, they said, which is kind of weird to me.
Right, if you're staying the night.
Yeah, but there's just different classifications apparently. And then also, throw another wrench in there. There's some Medicare Advantage plans that actually don't have that 3-day rule. They have different rules. So, again, very, very individualized here.
Yeah, so not only do you have to understand Medicare as a whole, then you have to go even further and understand your plan.
Yeah, all the more reason to reach out to those people that do this stuff all the time and use those resources. That's, they're invaluable. All right, another thing that is not covered in traditional Medicare is dental and vision coverage. Also, hearing aids. Some of those things that you might use when you get older, not actually covered under the Medicare system. But that might be one of the pluses for you if you're considering a Medicare Advantage plan, is that those things may be covered in addition to A, B, and possibly Plan D. So again, little tiny nuances there.
I know, and it seems kind of strange that those things that we need more and more, we're going to need our glasses, we're going to need help hearing. We hopefully would want to take better care of our teeth.
Yeah.
All right, so the page 8 of the presentation from Fidelity. The standard Part B costs. Okay. This is a great graphic showing how much the standard monthly premium is. They have it broken down on the left-hand side, the individual filer, in the middle are joint filers, and then to the right shows if your income is within those limits, then that's how much premium that you would pay on a monthly basis for Medicare Part B. So if you are $88,000 or less as an individual, or making $176,000 or less joint together with your spouse, then you would pay the minimum monthly amount of $148.50. From there, it increases, as you can see, to where you could be paying as much as $504 a month. And these numbers are for 2021. The numbers for 2022 are not released yet. But we should have those out any day now, actually.
But like most things, I'm assuming that they do ratchet up almost every year.
They do.
Little things that pick up here and there. The neat thing for me is that at the top where it says the 203 deductible, that's, your Medicare Part B has a deductible. They don't offer any new plans that don't have the deductible. So if you're not in Medicare already, you're going to be subject to that $200 deductible. Then there's a 20% co-insurance for certain things. So it's kind of nice that it's laid out with the premium.
It is. And the other thing that I should mention is that the same can be true if you have Part D, that those premiums are also graduated to increase as your income goes up. Oh, which is on the very next page. Perfect.
Yeah.
So it can get really costly. So that goes back to that original slide that Valerie shared with us, in that a 65-year-old retiring couple can expect to pay $300,000 out of pocket. And this is part of that.
Yeah. Well, another important thing to consider here is that this is looking at, even though you might have a joint filing income, AGI, that you're looking at, those monthly premiums are per person. So even if you're a couple and maybe you are a high earner, you each are going to pay that extra amount for your premium. So really, I think we've been talking a lot this entire time about everything being very specific to you, your lifestyle, your health needs, your medications. Those are all factors that need to be considered. And when you have, as I can show you here on this graphic, a lot of different options, all the more reason to really, talk with someone and make sure that you're getting the best thing for you, and maybe not just what your neighbor has that is great. So really, there's a few different things going on here, but it kind of lists all your benefits on the left side, all those things that may be covered, Medicare Part B co-insurance or co-payment, first 3 pints of blood, Part A hospice care, skilled nursing facility with some co-insurance, and then deductibles. Deductibles is a big thing for some of those policies or the plans. One thing to note here is that plans C and F are no longer available after January 1st, 2020.
Unless you're grandfathered in.
Correct. So we got C right here and F. And those two, the reason that is because that Part B deductible, like we talked a couple slides ago, that $203, any of the new plans, you're going to be paying that. Yeah.
The other thing to remember about these is that these are standardized no matter what state you live in. So whoever you go and talk to, they have to offer these exact plans. These cannot change. The only thing that can change is how much each insurance company might charge you for the coverage. So keep that in mind. They are standardized plans. You want to go most likely where you can get the biggest bang for your buck at that point.
Yeah, so like what you're saying is basically if you're looking at like a plan N or M, what you're going to do is just go, if you want that same plan, you compare this to the cost for that same one across a bunch of different companies and go with the lowest one because it's that one plan. It doesn't change. Okay. Go ahead.
No, I was just going to say, and because it's a standardized plan, wherever you go that accepts Medicare will accept whatever plan you have. So as long as and I don't know of any off the top of my head, any hospitals or doctor's offices that don't take Medicare, but wherever you do find one that accepts it, then they will take any plan. You don't have to worry about it being a specific one.
That's a good point because Medicare Advantage plans, sometimes they look more like typical health insurance where they are accepted some places and some places are out of network. So, you know, where you live is a factor as well as, you know, all the other stuff we just mentioned. But really, you know, we just wanted to give everyone kind of a recap of what we talked about with Valerie and her great Medicare information, as well as what comes right from Medicare themselves. And, you know, really, there is so much to this that we just want to make sure that everybody has the information that they need. You know, they can go talk with someone that really knows a lot about this stuff and get what works for them. They list, there's these organizations that are called State Health Insurance Assistance Programs, SHIPS as an acronym. And you can look up in the Medicare booklet or on their website the phone number for your specific state. If you want to talk with someone, you can always call 1-800-Medicare. I don't know that number off the top of my head, but I do know it spells the right number. And actually, the offices of the aging for your local area should be able to help you. We know a lot of the ones locally actually have calculators and tools like that you can have your specific drugs put in there and find out which plan is the most cost effective for you and what covers what.
You can do that online too with putting in your prescription drugs, but I would say just have somebody else do that work for you.
There you go. Yep. But really, we wanted to get this information out to everybody. If it's something that you're struggling with, you know, now is the time to really take a look at this. You do still have time. You're not missing out yet. But definitely go talk to someone if you have some questions, and hopefully this was helpful.
Good luck with enrollment day on October 15th starting.
Yeah. All right. Well, thank you, everybody. Thanks for listening to our Lakeside Chat recap.
Thank you.